Hello to everyone. We will get started in just a few minutes as we all collect ourselves and come join. We have a minute or two before we get started. Feel free to settle in. We have a wonderful slate of the event going on tonight and are looking forward to you being with us. So glad you're here. One thing I will prompt people for as one of the activities that we're going to do today as part of our intro, we're going to invite people to think about and share what you've done over the past week for your own self-care. So think about that, and if you have anything that you're willing to share to inspire the rest of us, we'd love to hear that. So just think about it, and we'll give you a means to share that in just a few minutes. Our numbers are growing. This is great. Always glad to have all of you with us. Thanks for being here. We will get started in just maybe 2 minutes, give people an opportunity to get in, make sure their links are working, and we will get started in just a moment. Okay, we're going to go ahead and get started. I'm really excited to have all of you with us. My name is John Richardson Love. I'm the Director of Mental Health at an organization called Child Savers, founded in 1924. We're getting close to celebrating our 100th anniversary. Working here in the city of Richmond, working with children and families to support their mental health and well-being in a variety of different ways. It's a privilege and honor for me to be able to be here today and with a lot of wonderful panelists who are here with us tonight to share their expertise and wisdom. This is the RVA Engage event, and our focus tonight, again, is mental health and mental wellness, mental health and well-being. As we get started tonight, it would be a shame for us not to acknowledge the tragedy that happened very close to us, and I think affecting either many of us or the people who we love and care about at the University of Virginia this past weekend. And we want to share just a moment of silence and acknowledgement to be aware of what happened and to honor the loss. And to I also invite you during this moment of silence to think about healing and growth and what we can do to make sure this doesn't happen again. So I invite you into a moment of silence. Thank you. I think there are a lot of opportunities for there are a lot of people who connect mass shootings with the topic of mental health, and unfortunately, there's a lot of research that sort of debunks that and says how it's not relevant, how most mental health services are not going to directly prevent mass shootings and events like this. They can prevent it from a community wellness perspective. But I did want to put in the chat a resource for people. And this is a citation that came out that I just came across my radar just today from Pew Charitable Trusts, that is how mass shootings like this event that happened this weekend have a ripple effect across communities and beyond. So invite you all to work towards healing and support of one another in our community. So to start us off today, wanted to invite you into a word cloud. I am biased towards word cloud. I like doing this when I present to larger groups. And this word cloud that I invite you in, there's a QR code in the top left-hand corner there. You can do a couple different things, and I will grab this link and put it in the chat. You can click on that link that's in the chat. You can scan that QR code with your phone. It's in the top left-hand corner, or you can go to slido.com and type in that code. But I want to invite you into answering this question with us. What have you done in the past week for your own self-care? What have you done in the past week for your own self-care? Part of what we're going to talk about tonight that I'm sure is going to come up as a theme is making sure that we as individuals are keeping ourselves good, not just for today, but for tomorrow too. We need to be able to have sustainable practices so that we can be good in all the different roles and hats that we wear to make sure that we're doing what we can do to take care of ourselves. One of the reasons I wanted to do this word cloud was because I'm sure that many of the things that are there, some of them will be kind of generic things that we all do or we all might do, but I'm sure that someone and people will have things that will be inspirational that they'll put in this word cloud as well, things that others might not have thought of, and maybe things that other people might want to build into their own practices. So love the participation here, all sorts of wonderful things. Things that, and self-care is a wonderfully individualized topic that some things on this list might work for some people and might not work for others. Things like karaoke or video games or outdoor group meditation might be things that are not as generalizable, and that is absolutely okay. All sorts of great stuff. Ran the marathon, lunch with a friend, napping. I think it's been decades since I've taken a nap. Great stuff. And the bigger any item is in this list, the more it's been suggested or put in there. Great job. Wow. Great response. Thank you for sharing all of these. As we continue during this workshop, during this event, you are welcome to continue to populate this word cloud. And what I will do is take a screen grab of this. And as we share resources as follow-up from this event, I will tag that along and work to make sure that this screen or a word cloud that you have created is able to be shared with all of the participants. I'm going to take us off screen share and move us along. Thank you again for all the wonderful participation there. I hope that there are some things in there that will inspire you. Again, I'll share a screen grab of this in the follow-up email. As we move along, I want to welcome everyone, welcome all of you as attendees to the 4th Civic Action Conversation brought to you by RVA Engage. A quick bit about RVA Engage. It's a collaborative of community engagement professionals in the nonprofit, corporate, government, and educational sectors seeking to inform and catalyze community members to engage in issues that most impact our region. Wonderful opportunity into a conversation. Tonight's event in the Civic Action Conversation Series is brought to you by the following community collaborators that are wonderful supporters and sustainers of our community working towards wellness. The Bonner Center for Civic Engagement, which is at the University of Richmond, ChamberRVA, the Community Foundation for a Greater Richmond, PlanRVA, Virginia Commonwealth University, and Virginia Public Media, or VPM. The 2022 Civic Action Conversation Series is focusing on critical regional priorities and possible action steps for engagement. Very important, not just talking about the problems, but seeking solutions. The topics of this series are chosen because they reflect some of the highest priorities that are seen in our community. The series will seek to present multiple perspectives on each topic. And we invite you as the participants to listen, to learn, and to take action in a way that makes sense for you. Tonight's focus is on mental health and well-being. The purpose of today's session is to highlight some of the expertise in our region. We know that there are so many more people and organizations whose expertise and work are critical, but will not be reflected directly here. But we want to acknowledge that there are many other champions for this topic in our community. We've invited a range of voices here tonight for different perspectives to spark our thinking. So as we enter into our conversation tonight, we invite you all to enter any questions that you have into the Q&A, and a moderator will work through to try to get them answered and jury them for the speakers to be able to respond to. Anything that you choose to share in the chat, you're welcome to convey information and possibly to share resources for your fellow participants who are also here. A recording of tonight's event will be posted, as well as the resources that are shared tonight, at rvaengage.org as soon as it becomes available, and we'll send all registered attendees an email to alert you when it's available. So we're going to start out with a presentation by Mary Beth Walsh, who I'll introduce in a moment, and then we will have a Q&A. So think about if you have any questions for her specifically, and then we're going to open it up into a larger panel to have a discussion, more of a discussion about this. So again, think about your questions and put them in the Q&A. So now we're going to invite in Mary Beth Walsh, who's has a master's degree in social work. She serves as the director of programs with NAMI Virginia, National Association of Mental Illness. She serves as NAMI's signature and she oversees all of NAMI's signature and non-signature programs for children, youth, adults, and families impacted by mental illness. She has experience speaking on topics related to children's mental health, leadership development, peer support, crisis planning with families, general mental health information, as well as the mental health care system. So again, any questions that you have for her, please put in the chat. And right now I want to welcome to the microphone and to the stage, Mary Beth, to share some wisdom with us.
Thank you so much, John. It's a pleasure being here. I'm honored to be the speaker to jump us into this important topic. And I will try to get through this content as swiftly as possible because I know for myself, I look forward to hearing from the panelists about their experiences. So I'm going to go ahead and ask that the slides get pulled up, please. Wonderful. I won't go into any more detail myself because John did a wonderful job introducing me. But I do want to just go ahead and move on to the next slide. So I wanted to kick us off with this statement, a fact or fiction statement related to mental health, and it's mental health problems don't affect me. And the answer to this, of course, is that is fiction. Everyone experiences mental health, and it should be treated as commonly and openly as physical health. But what does that look like? What are the data trends? What are we seeing when we talk about mental health in general? Next slide. So 1 in 5 U.S. adults experience mental illness. And in Virginia alone, that's 1,115,000 adults, 4 times the population of Richmond. And then when you look at other numbers associated with mental health, there is 1 in 20 adults experience a serious mental illness. And we'll talk a little bit more about serious versus mental illness in a minute. But in Virginia, that number is 264,000. And then there's 1 in 6 youth who are impacted by a mental health disorder each year. And then in Virginia, that's 97,000 Virginia youth. Related to suicide, 1,243 lives were lost to suicide, and 267,000 adults had thoughts of suicide in the last year. So those are some pretty sobering numbers. Next slide, please. So Of course, as we all know, we had this little thing called a pandemic with COVID, and that really brought a light or it shined a light on the topic of mental illness. And we saw this huge surge, I want to say, in the experiences of people with their mental health during the pandemic. So more than half Americans reported that they had a negative impact on their mental health because of COVID-19. And when they studied they put out a survey in February of 2021, 36.9 of adults in Virginia reported symptoms of anxiety or depression during COVID-19. But what I want to focus on is point two, related to youth. Rates of the suicide ideation were highest among youth, especially the LGBTQ plus youth. Overall, about 51% of all youth depression screeners were aged 11 to 17, reported frequent suicidal ideation on more than half or nearly every day of the previous 2 weeks. And this study was conducted in 2021, so right in the middle of what everything going on with COVID-19. And then the suicide ideation increased mostly, though, for youth, BIPOC youth. And so between 2019 and 2021. So we're definitely hearing a lot in the mental health world about not only the struggles with everyone with their mental health, but especially with young people. And so just a quick plug to check on your young people. This is something that we're seeing, and data, of course, is still coming in because we're still fresh out of, I don't even know if we're going to be out of COVID-19, but we're fresh out onto this new normal that we're in. So more data is coming out probably. Next slide, please. Again, in thinking about mental health, though, all of those numbers, mental health really does fall on a continuum. You know, you have people who potentially live with serious mental illness, so schizophrenia, bipolar disorder, major depressive disorder. But it's a varying level of how we all fall on this continuum. Just like with physical health, you have Olympic athletes, and then you have people like me who are not Olympic athletes. The same thing can be said with mental health. You know, we all experience mental health in some capacity. Next slide, please. But if we all experience mental health, what is one of the big barriers for people seeking care? 1 in 5 adults are living with a mental health condition. We all experience mental health. What is causing this barrier? What is a challenge in that? And really, that is stigma. And so I have a question here, and I really want to quickly just get some thoughts from you all. So you can just throw it into the Q&A or question or chat. But if you can think of a slang word for someone with a mental illness, you can just throw in any slang word. It'll be really quick. And if I can't see anything in the chat or Q&A, I'll start kind of, yep, crazy. Crazy, that's pretty much the common one. Crazy, insane. Yep. Looney Tune, yep. Absolutely. Special. Nuts. Psychotic, yes. So we all hear these terms. We all know these terms, but then I'm going to challenge you to have that same question, but relate it to somebody with diabetes. Can you think of a slang word for somebody with diabetes? And if you can, sugar. I have heard, so I've done this presentation before, and that did come up, and I got the sugar. Yes, I guess that's a good way to look at it. But I will say that in doing this, there's not as many. But it's really to show that with physical and chronic illness that most people may be dealing with, people will seek care for physical illnesses that are chronic, but there is that barrier because of how society might be viewing or seeing somebody with a mental health condition. Next slide. So in the NAMI world, we call mental illness the no casserole illness, mainly because if you grew up in the South like I did, where somebody gets sick, everybody brings a casserole. They knock on the door. But then there's the saying in the NAMI families that when their loved one has a mental health condition, there are no casseroles. So stigma really can impact this whole conversation. It brings about feelings of shame and blame and hopelessness. And there's misrepresentation in the media, which also plays into stigma. You know, I see movies all the time about people being placed into psychiatric units, and it probably looks nothing like a real psychiatric unit. So there are all of these things that really do keep piling on and creating this society of stigma around mental illness. Next slide, please. So a report of the Surgeon General identified stigma as one of the major barriers that discourages adults living with a mental health condition from seeking treatment. But even if they do seek treatment, there are clear disparities in accessing care. And here are a few of when the mental health report from 2022 stated in Virginia, so that more half of people have a mental health condition did not receive treatment. 8% of people in the state are uninsured. Virginians are 7 times more likely to be forced out of a network. And 56% of Virginians aged 12 to 17 who have depression, this goes back to that youth topic, did not receive any care in the last year. This is a snapshot of disparities in access to care. I could talk and I could give an entire presentation on this, but I wanted to just give a quick one before we have our panelists kind of discuss their experiences with that. Next slide, please. Really quickly, I could also give an entire presentation just on resources, but I wanted to give a brief snapshot. This pie, by no means, is an exhaustive pie. The slices, these are the slices I chose related to mental health system and resources locally that I could think of. And I'm going to pick a couple just to talk about. First, we have community services boards. They are typically what we call in a community the mental health authority. And each county has one that provides services to individuals and youths. And they were established by local governments pursuant to a Code of Virginia in 1968. So again, every county or city established has to have a CSB, and you can find one in your locality. I believe I gave the link to get to there, but if not, I can always resend it. So that's one resource. Then you have peer support. That's something really new. It's very exciting. We've had it for, goodness, I've been in this business 11 years. I want to say 8-10 years of that. And so peer supporters are individuals who are paid to provide a support to other people who are impacted by mental illness, to help them walk through the system, to understand what might be happening, because the system can be confusing. We then have 988, which has replaced 911. I'm sure you all have heard about it. It is very new. It was just implemented in July, so we don't have a lot of data in the state of Virginia about how it's operating, but I can tell you from experience and from operating an informational helpline that we haven't heard as much from people in the state about it being negative or having any negative responses to it. But it is that one area that people can go to help with if they're in a crisis. And then we have local programming. You have local NAMI affiliates. You have local clinics that offer and provide services. So again, these are just a snapshot of resources. I'm sorry I'm flying through that, but I wanted to just kind of visually show you what that looked like. Next slide, please. So what can we do? I just gave a lot of information, some data that you probably were like, oh, I want to help, or like, oh, this is impacting me because 1 in 5 people. So at NAMI, we talk about advocacy as little a advocacy and big A advocacy. Big A is what we refer to as like legislative advocacy, going and speaking at budget hearings, meeting your representatives, organizing rallies, and that's all important. And we do that at NAMI Virginia. We provide opportunities, but what I want to focus on is little a. These are the moments that cause those ripple effects that can really be impactful and help people build up to the big A, to the policy change. Things like telling your story if you have an experience, being a peer supporter, filling out a survey. I know it sounds silly, but those surveys are really important. Recently, the Commissioner of Department of Behavioral Health and Developmental Services released 5 surveys because they're looking to improve services in the state, and they want to hear from you. They want to know what your thoughts are. And so this is an exciting opportunity to have a voice in that system. And then language. I mentioned stigma. going back to the language, trying to alter things that we say, or like catch ourselves and say things instead of the weather is bipolar. How about just the weather seems to be really overcast today? Things like saying, instead of a person, somebody is schizophrenic, it's a person living with schizophrenia. All those little changes we can make in our daily lives will have a big impact. Next slide, please. So it wouldn't be a NAMI Virginia presentation if I didn't explain what NAMI Virginia does. So we are the Virginia office of an affiliate. So we have local affiliates sprinkled across the state, about 14 of them. And we provide education and support and advocacy for individuals and families impacted across the lifespan in those communities. Our affiliates are boots on the ground, providing free programming, support groups, you name it. Our programs are peer support led. So they're all led by families and individuals who have a lived experience. We're a membership organization, and we also provide advocacy at the state level. So if you are interested in being involved in advocacy, we provide opportunities through our action alerts. We do a call out for things that we need. If there's a bill we would like people to comment on, we will let you all know. So those are just ways that we have tried to put our mark on the conversation around mental health and how we can all support one another during this time. And I believe that is it. I think I managed to do that in 10 minutes. Again, I know that was brief. So if you have questions, I'm now ready to see if you have anything.
Thank you, Mary Beth. And I know that you could go on for a lot longer. You have a lot of great information to share, and I'm sorry that we can't give you more of a platform, but it makes hopefully will inspire people to invite you in and want you to advocate more and help them advocate.
Mm-hmm.
A few questions that we've gotten. I know that NAMI was instrumental in working with the Marcus alerts and 988, some of the advocacy we've done over the past few years in terms of crisis response in the world. Any particular things that are hot buttons on the platform of NAMI coming up with the next General Assembly session or otherwise that we can be aware of as constituents in the community?
So that's a great question. We are currently gathering data. We sent out a survey because we want to base our policy priorities off of what the constituents want to see, what they're passionate about. So we are currently still pulling that data in. But what I can tell you, just from some of the data that I mentioned, is that youth and young adults are going to be, I think, a pretty big focus point. Especially within even the federal government and down to the states. Like there is a lot of talk around what can we do? How can we provide services or better equip families to provide care and support for children and youth who are impacted?
Okay, excellent. And people can certainly go to the NAMI Virginia website to learn more about what their platform has going on. A question that came in through the Q&A around access to care, specifically the fact that all providers of mental health services are not necessarily in network with any given insurance company. Do you have any suggestions of how an individual can advocate to make sure that the provider that they want to see can be made a part of the insurance network that they happen to receive services from?
Ooh, that is a loaded question. And I wish I could wave a magic wand and fix the access to care through insurance companies, because that is like one of the top concerns that come in, and that could be something that we see a little bit more of in the General Assembly. But unfortunately, I don't have a good answer for that right now. I advocating would be finding when you need care is like what I would go down to, like to the basis, the provider, and having them advocate for you as well. I know that growing up with my in my family, the doctor was very much so a advocate for a need for services within the insurance company and writing lots of letters and making claims as to why it was important. But yeah, just kind of telling those stories and also telling us what's happening is really helpful. If you have these experiences, please let us know, because I know our advocates would take those notes and ask for things that we need. So.
Excellent. And hopefully, I know that my organization, Child Savers, is doing some advocacy in partnership with Voices for Virginia's Children to hopefully allow paneling for insurance companies, which is too much to get in the weeds, but to allow more flexibility for providers to actually receive reimbursement. So hopefully we'll all be able to advocate for that.
I did have a really good conversation recently from a provider who is moving into Virginia, and they provide like an in-home service for like kind of like a full wraparound team of care service. And they are working with being part of every provider. Like they have meetings like they're nationwide. And so this is an exciting thing for Virginia if it works through and gets, and like I think they're working on Medicaid right now. So hopefully that will happen. And if that happens, we'll definitely provide that resource on our website too.
Great. Another question you had mentioned about the disparities of mental health services and mental health impacts during the pandemic. And there's a question specifically asking about, and this could be a whole another workshop in and of itself, of what populations that the data shows experienced inequities.
Yes, so they have pulled, excuse me, this report did pull that data. I just had a very short amount of time. And so if you would like to see more data, I believe I sent the link in with the resources, but if not, it is located on our website under resources. I believe there's a data tab, but with COVID, like I said, they're still pulling data because it is still fresh. So I'm sure those numbers are going to change. We're going to end up getting even more understanding of what has happened and what kind of impact it's had on which communities.
Great. And I think Christina just put that in the chat, or will, to make sure that we have access to that link. Last question for you, Mary Beth. Anything that's being done to address the stigma in hiring? If I'm an individual with lived experience of a mental health problem that's now resolved and not going to impair my ability to work, and I'm in recovery, yet my employer still has the option to stigmatize me and discriminate against me because of my history, which isn't necessarily going to affect my work performance. Is there anything being done to decrease my barriers to being hired and being a part of the workforce?
Yeah, that's a really great question. And thank you for sharing that question. I always say when I give presentations that it is up to the person to disclose whether or not they, if they want to disclose their history to their employer. What I can say, and what was a positive thing about COVID, is that from that, because everyone was seeing such a decline in mental health and mental well-being, is that we were receiving more requests for presentations in the workplace. So managers and leaders were asking us to come and speak to their team, their leadership teams about mental health, educate. So I think that there is a shift in the conversation. I'm starting to see it, and I'm very positive and hopeful that we're gonna see a lot more of the stigma starting to kind of go down in the workforce and in the workplace.
Great. Thank you so much, Mary Beth. I wish we could give you another hour or two to talk to us, and all of our participants should know that NAMI does a lot of not only community advocacy, but community education. And you can definitely get in touch with them if you feel like that's relevant to bring into your workplace or community event to help work on the issues that we've talked about, which are so very important.
Yes, thank you for having me.
You're welcome. Thank you. Thanks for being with us. So we're going to engage in a little bit of interaction over the next few minutes, and then we're going to get to our panelists. We're going to bring up a poll with 3 questions here. You might need to scroll down because there are 3 questions. And these questions start off with, what is the percentage of people in the United States that will have a mental health diagnosis at some point during their lifetime? Second question, how confident would you be to respond to and support a family or friend, family member or friend who is having a mental health concern? And what would the top thing be, the top barrier that might keep you or others that you know from seeking a mental health service? As you all are dutifully responding to that, which we really appreciate, I'm going to put in the chat another resource. Have wonderful resources to share with you tonight. This is a Surgeon General's report that just came out over the past week or two on workplace mental health, which might have some fascinating statistics if you would like to look at them. So folks are responding to that poll. Thank you very much for doing so. Give folks another moment or two to participate if you'd like. All right, in the interest of time, we're going to end that poll and share the results. So question number 1, people said 70%. Ooh, wow. I forgot to put on this list what the right answer was. Pretty sure it's 50%. That is a statistic that was pulled from that workplace mental health and well-being put out by the U.S. Surgeon General that is there in the chat, but a surprising amount. Second question, how confident would you be to respond to and support a family member or friend who's having a mental health concern? Over half of you said you'd be confident or very confident. And that's a wonderful thing. And that's a wonderful gift to the people in the community. I hope that's reflective of the people at large in our community. And then the top barrier that might keep you or the people you know from seeking a mental health specialist. We have a pretty even distribution here. Finding the right words was the top response, but a wide variety of reasons, which we're going to get into with our panel coming up. So we'll go ahead and stop sharing that and introduce our panelists. So I invite our panelists to come up and be introduced. So I'm going to start with Muriel. Dr. Muriel Azra Evans is the director of the Department of Mental Health and Wellness at Health Brigade, a nonprofit clinic whose mission is to provide exceptional health services to those least served in a caring and non-judgmental environment. She has a BA in psychology, a PhD in human development and family studies, and an MS in rehabilitative and mental health counseling. Dr. Azra Evans is a licensed professional counselor, a certified rehabilitation counselor, a certified family life educator, and a certified clinical trauma professional. Next, we have Eric Clay. Eric is the staff lead for health and wellness initiatives of both the Community Foundation and the Jenkins Foundation. In addition to facilitating the grant application process for both organizations, Eric plays a strategic part in identifying community solutions in the health field. He most enjoys working with communities to create necessary and sustainable opportunities for historically underserved populations. Shamir Miles is the Family and Community Engagement Liaison at Peter Paul Development Center, where she connects parents, caregivers, and community members to the programs at Peter Paul Development Center. Shamir was also a community researcher with Virginia Commonwealth University, where she explored and investigated social determinants of health through mixed methods research and provided community-based solutions for successful interventions. We also have Amy Popovich, who Amy graduated from the University of Virginia with her BS in nursing and her MS in community and public health nursing. After 5 years of inpatient hospital nursing, she joined Richmond City Health District and had the opportunity to start health clinics in public housing communities. She later became the Director of Community Engagement for the Health District, and in November of 2018, Amy became the Nurse Manager of Richmond and Henrico Health Districts. Lastly, we have Dr. Lucy Roberts. Lucy is an educational psychologist who serves as the practice specialist for the National Health and Wellbeing Practice at One Digital. Lucy works with employers to solve some of the top business challenges by helping organizations attend to their greatest asset, their people. Lucy's training and research, coupled with her time as a mental health practitioner, has uniquely positioned her to help bridge the gap between the need for mental health care and access to resources. We have a wonderful and robust panel tonight, and have a wonderful opportunity to ask them some questions tonight. So we invite you, if you have questions for them, to put them in the Q&A, or we will work to get as many of those addressed as we can. So first question to all panelists, and I will kind of bring you in just so we don't have the cacophony of everyone talking at once. So I'm going to address this question to everyone. I'm going to invite Amy in first to answer this question. And it's a simple question, no need for a treatise or a dissertation on it. Simple, straightforward question. How do you define mental health? So Amy.
Thanks, John. Glad to be here. I think in the same way, health is not the absence of disease, but the wholeness of a person. Mental health is not the absence of mental illness, but the presence of mental well-being.
You can take that one to the bank. This question is going to be harder for those of you who have to answer later. And I apologize.
Thanks for letting me go first.
Eric, let me invite you in to give your perspective on how you would define mental health.
Sure. Thanks, John. Good evening, everyone. So at the foundation, we define it as historically neglected and under-resourced individuals and communities in our region have equal and trusted access to compassionate and quality coordinated mental health care.
Excellent. Thank you. Shamir, I want to invite you into the conversation next.
Hi, John, and good evening to everyone. For me, my definition is how do I feel, how do you feel, and how do we cope or manage it?
Drop the mic. Lucy.
Yeah, thanks, John. So you have all probably heard that everyone has mental health. Well, I like to think of it as everyone manages mental health, from day-to-day stress to finding balance in your life to seeking care when you need it.
And I left Muriel and her brilliance for the end here, and I'll invite you in.
Thank you. I can't say ditto, I don't think. I think the way I look at mental health, or the way I define it, is inclusive of just well-being. So I like the term well-being. I think there's less stigma around it, but it's psychological well-being, social well-being. It can include emotional, spiritual. So to me, I look at it as a sense of well-being for the person.
Excellent. Thank you so much. So Amy and Eric, I want to invite you into this next question, and you can go in whatever order you want, whoever unmutes first and starts talking. How do you see mental wellness fitting into the larger picture of our community being a vibrant and strong community?
I guess I'll go first. Amy. So, I think it's an important ingredient. It's the glue, actually the secret sauce, if you will, to a vibrant and strong community. At the foundation, we've learned that mental health cannot be treated as an isolated issue. For instance, at the foundation, we have 4 primary focus areas that we fund: health and wellness, community vibrancy, economic prosperity, and educational success. Now, prior to the pandemic, we saw mental health support landed consistently and more firmly within the typical health and wellness focus area. But COVID, as you heard earlier, has significantly blurred those lines. So having to adhere to social isolation mandates has disrupted routines, particularly the ability to stay connected to mental health related support systems in individuals, which resulted in higher levels of depression, anxiety for both clients and practitioners in all areas. And so mental health is just exacerbated issues in all of our particular focus areas.
Great, thanks, Eric. Amy, do you want to respond to that?
Yeah, thanks. Mental health is foundational and is a part of all of us. From a public health perspective, we look at the social determinants of health for a person. So someone's access to housing and education, access to food, healthcare, and someone's mental health really affects their ability to be able to access that and follow up. Mary Beth mentioned some of this data, but mental health increases the risk of some physical conditions like cardiovascular disease and substance use disorder. Unemployment rates, are higher in individuals with mental illness. So a mentally well and strong community means less cost to society for emergency room visits, incarceration rates, but more people to contribute in meaningful ways to workforce through strong and vibrant families, and each of us being able to express our unique gifts and talents to the world.
Awesome. Would anyone else like to respond to that question? How mental wellness fits into a larger picture of a strong and vibrant community?
I would say for my community, the term that's often used for us is probably resilient. When we look at it as we're surviving, when I think of resilience, I think of a rubber band and being stretched to stretch. So if I put that in context to myself and my neighbors and my children, I don't want to be compared to a rubber band who is just supposed to be stretched and pulled. And then if you tear a rubber band, you can also tie it back in a knot and reuse it. So I just look at it as not being resilient, that we are surviving. And when we're better together, when we are addressing our mental wellness and being supportive to each other. And that's what helps our community, is being able to come together and address mental wellness in support of each other.
That's great. And Shamir, a great highlight to the fact that oftentimes the term resilience is thrown around, but also there are communities and individuals who feel like resilience is not the term that they want to identify with. So thank you for sharing that. Next question to Shamir and Muriel. What does mental health encompass? When you think about mental health, it's I'm sure broad and wide and in terms of a lot of domains, but can you give a brief example of how and why mental health matters? What does it encompass, and how can we think about that beyond what we've already said?
Mental health matters across the boards of housing, education, parent involvement and engagement. If I'm not feeling mentally well or supported, or even being able to acknowledge that I'm not feeling myself in these areas, then it prevents me from being able to be engaged in my child's school, in my community, hold employment, show up at other places where you may be required to show up. So I think I would say having the language and the voice to be able to articulate what a person's experiencing, to be able to share, in order to share, to be able to identify what next steps should happen.
Great, thanks.
I agree. I think it matters, just like we would argue that physical health matters. And I love Mary Beth's, description of it being a continuum. I love the idea for comparison with diabetes. All health includes mental health. And so it impacts every choice that we make. It impacts relationships. It impacts our work. It impacts relationship is a big one. I keep going back to that, but it matters because you can't ignore it, and it's going to find a way to influence general well-being. So I think it doesn't occur in isolation, and so I think its broad impact is why it matters.
Great. Anyone else want to give any response to that? What mental health encompasses and how mental health matters? All right. Lucy, you're up next. How do you see organizations and workplaces successfully supporting the mental health and well-being of their employees? Can you inspire us?
I'll do my best, and I will echo Mary Beth in that I will try to keep it very brief, but I could speak on this for hours, as I'm sure we all could. But I love that you added the qualifier successfully into your question, John, because the truth is we're hearing a lot of buzz around taking care of mental health in the workplace. And it's fantastic to hear about it. But it can be a little tricky to know how to actually effectively support all the employees across an organization. Now, at the beginning of the pandemic, we saw organizations recognizing need and responding by offering support to employees to navigate the challenges they were experiencing. But in reality, regardless of any good intention, many efforts have actually fallen flat. What we've found is that more than just doing something, organizations actually have to be intentional about doing the right thing. And so what I mean by that is there is no one size fits all approach. We generally see organizations have success when they take intentional and strategic approaches around three main areas, and I'll just touch on them briefly. First, organizations who are successful in helping to support employee mental health understand their employees' wants, needs, and interests. They may gather this information through employee surveys or in some other way, but they're really tuning into the unique challenges based on their industry, as well as employee demographics and employees' own words about what they're experiencing as far as challenges. So it could be that employees in your organization are experiencing financial stress, or it might be that you have a large group of Generation Xers who need support caregiving for a parent or loved one. All of these things affect our mental health. The second general area we see success in is when organizations actually look at their policies and their environment and their culture. So when they consider whether or not their policies truly promote balance in the lives of employees, when they invest in psychological safety training for managers to recognize signs and symptoms of mental health challenges, and also to promote an inclusive environment. And then another thing I wanted to mention here is that when you tune into stigma, it is critical for an organization when you're considering success, because you want your communications from leadership and across the board to be stigma-free and inclusive. And the last point here, in the area that we see a very big push in right now, is expanded access to holistic well-being benefits. Now, there are a range of third-party solutions that are actually curating networks of therapists so that employers can actually pay for their employees to have access to therapy almost on demand. There are tons out there. It's a very exciting time right now. It is, costly, so that's part of the barrier to get that down, and hoping that that continues to be more accessible. But truly, all of this just scratches the surface. Hopefully, it provides with a little bit of context here, some ideas and things that you can consider for your workforce.
That's great, Lucy. I am sure that there were some managers and employers, hopefully, who are taking notes as you went through that list. I don't know if any of those that list is in the links that Alexandra put in the chat, but any of you who need to, you can definitely get the recording of this and rewind and find that list if you need to share it with your boss. Eric, up next. Can you speak to the funding priorities of the Community Foundation? And maybe even the philanthropic sector at large, as much as you know it, how the support of mental health has changed over the past years, the focus on mental health, which you alluded to earlier, and how they're working to specifically support mental health and mental wellness initiatives in our community?
Sure. So at the foundation, our overall priority, I guess, in full transparency, the death of George Floyd is having a significant impact on our work. We continue to target resources towards under-resourced populations, but we're now discussing how our impact can be more transformative by considering more systems, advocacy work, strengthening relationships with our grantees and local community, and deepening our relationships with local funders. So some of our equity work will entail responding to issues regarding systemic racism, and we heard that Black and Brown communities are more impacted, listening to understand and not just responding, developing a strength-based approach to community building, reviewing our internal systems and practices to ensure that we are being equitable and fair, so some internal work, and also utilizing our power to echo community voice to make a lasting change. And as it relates to the targeted mental health work we're doing with our philanthropic sector. So because we partner with the Jenkins Foundation, which is a health legacy foundation, we're able to address broader mental health concerns in the region by leveraging our joint resources. So we both support direct service organizations like yours, John, Child Savers, whereas the Community Foundation supports more systems work and trauma-informed care, and Jenkins supports substance abuse related issues, and we know there's a direct connection between mental health and substance abuse. So this year alone, Jenkins invested over $1 million to support mental health and substance abuse related problems. Sorry, I might just go off in here. Additionally, Richmond Moyer Health and the Scheinberg Foundation are convening meetings regarding community violence and community health and strategies to better support older adults. So changes we're seeing in mental health, as you heard, the workforce is significantly impacted. And that's what we're doing. We have a MSW student from VCU who's doing some research for us in that space. And also even Spanish-speaking clients. What are we doing to make sure that they have access to our systems as well?
Great. Thanks, Eric. So some good stuff coming from funders because people can't deliver services if the money's not there. Super important. Shamir, I'm going to invite you in next. And Shamir, you and I go way back, and I know you could talk about this topic for easily an hour. But I know that during the early days of COVID, when people were isolated and not able to do the things that they had been used to doing, your organization, Peter Paul Development Center, did some innovative things to support the mental wellness of the community that Peter Paul Development Center serves, specifically parents and caregivers. Can you give us a little bit of that story, an example of how they took the services in the community, focused on mental wellness from a holistic perspective, and worked to support people in the community?
Yes, John. Again, like you mentioned, in the pandemic, during the time where we were all told to run, take cover, stay in your own homes, you've been around Peter Paul, and the culture here is our families, community members, caregivers, colleagues, we like to hang out at Peter Paul. You can come in my office anytime and find a caregiver, a community member, and we're just sharing a cup of coffee, and I'm doing work, they're doing work. It's a space that people really love to be in. So pandemic comes and we're all told, be at home, virtually work. And I knew even for staff, this would be challenging because our work is to come directly in contact with community. So I asked, our executive director, would it be okay to try to make sense of what we did online? And he said, whatever you need to make that happen, computer access, hotspots, backdrops, whatever you need to make that happen. So we quickly jumped online, created a nice Zoom link, shared it with our parents and caregivers and anyone who actually it didn't have to be for specifically Peter Paul families. It was anyone who was caring for a child, whether you were the aunt, the uncle, grandparent, brother, sister. The common goal was we all cared for a child in our life. And doing this online actually reduced some barriers that we would have had we done it in person. If we would have done it in person here at the center, maybe someone from a mile away would have not come. They would have thought, oh, it's just for East End families. It's just for Peter Paul students' families. Oh, it's just for mothers and fathers of the students there, not the grandparents or the aunt who has custody of the child or the siblings who now have custody of a younger sibling. We had, it also created, reduced the barriers with economical and other different kind of barriers like finances. Sometimes we think some services are geared towards people who fall in this income bracket or who don't have access to this. So in order to join in, your common thread had to be you were a parent, a caregiver of a young person. We had some people come as far as from Germantown who heard about parent and caregiver hangouts going on online and just had to come. So for an hour, you got me, some cool jokes, and some other people who were caring for young people at a time where most of us were confused. Despite our ties to organizations that we work for, we didn't know what the next day or next minute we're going to bring. And then at that time, you were faced with being responsible for a young person, and it was scary. So in one setting, you're trying to be the brave adult at the house, and then you can get online for an hour and say, I don't know what I'm doing. I'm freaking out. Have you got any good information? Do you know how to get access to this? And we will share resources. We not only had professionals join the parent caregiver hangout sessions, but again, remind you, the common goal was not our professions, our finances, our religion, our skin color. The common goal was we care for a young person. So in our groups that could get up to about 30, 40 people, you would have an expertise in this area, expertise in that area. A parent who was an expert in parenting, maybe because they were a grandparent, they've done it a bunch of times. We were all experts in whatever we brought as us as people to the table. And the information that was shared across the screen was amazing. They were 8-week sessions, and we ran about 9 8-week sessions back to back. We would take like a week off to kind of regroup, refresh, come up with some new, I had to come up with some new jokes, so people didn't get bored. But we would have people, we had return people who came to every session of 8 sessions. They were supposed to be from 45 minutes to an hour. We would be on there past 3 hours sometimes. I know for me, even though I was doing it through work, it gave me a lot of support. It gave me something to actually focus on and kind of restructure my day. You had a lot of idle time, and just something, it helped me to feel helpful in a time where I didn't know how to show up for my parents and show up even for myself. So it reduced a lot of barriers that we would have had it been in person. And it was great to meet new people, but seeing the resources shared amongst the people was like the magic and the secret sauce. And then when we came back in person, we were also happy that now we could see each other, but we still kept that reserved space online for people who just, we made connections all across the United States that way. So, we still run and we still check in with folks, and but it was a great opportunity to be able to do as a parent in the community, but it also was very rewarding as a provider to say, hey, I can still be of service to you at this time.
Thanks so much, Maren. You're really highlighting the fact that relationships and connections and attachments are so important, and that's regardless of whether you're the biggest introvert in the world, that those relationships and connections are still really important for our mental wellness. I'm going to ask Lucy this next question, and then ask if anyone else wants to respond to it. No obligation. How can employees advocate for themselves within a workplace for the support of their mental wellness? You gave a great outline of what managers and employers can do, but how can employees advocate for themselves?
Yeah, it's a great question. And as an employee, if you are not a top financial decision maker or part of the exec leadership team, you may feel like you can't really move the needle and make an impact on your workforce. But the good news is that you can. And part of it starts by educating yourself. So getting to know what is available to you as an employee, what resources, what benefits, well-being programs, you name it, and then understanding and considering what your leadership is talking about. You can also do something like join an employee resource group or an ERG. And these employee resource groups are voluntary, but really very, very impactful when it comes to organizations when you consider culture. And so an employee resource group will come together around a topic, it's all employee led, and they will share resources, experiences, and even host some internal events. Another idea would be to have a conversation with your manager about potential opportunities where you could either promote mental health or For example, if you're having a group meeting and it's virtual, ask your manager if, maybe you all want to take a walk outside and just have an audio call. Because again, we want to take a holistic approach to mental health and really consider the total well-being of an individual. Lastly, I think it's so important to model self-care and good mental wellness practices. So place boundaries around your time as much as you can. Check in with your coworkers and work to be someone who is a safe space for others, whether that's through your attitude, being inclusive, or really being open.
John, can I add a part to that?
Please.
Some of the parents and caregivers and community members that I have the pleasure of serving and working with, they work jobs that don't have employee assistance programs. They work jobs that if you're not in the building, you will not be paid. They don't have paid time off, sick time off, family medical leave. These things are foreign language if I'm asking them, hey, you're going through some stuff. I recognize you're not looking like yourself. What is going on? I'm stressed out. The school has been calling a lot of times. I'm behind on my bills. I have a lot on my back. I have no room to breathe. So for the working space that I'm in, normalizing that even as a professional, I'm your neighbor, but when they see me in Peter Paul, I am Ms. Shamir. But normalizing that Ms. Shamir has some of these same challenges and fears and phobias that you do as well. That there's no matter what my title is, was on the label of my door or the plaque on the back of the wall where the education comes from, we do not escape the same various traumas, triggers that anyone else does. So normalizing that. I don't have to tell my audience my life story, but being relatable so that they have the language to say, hey, I'm experiencing this, this, and this. No, I don't have that resource and access to my employment, but is it in my community? Is it something that's offered free somewhere else? Normalizing that we all, mental illness and wellness does not care about financial, race, color, kind. It can attack or be unmanageable for us all. And I think I'm going to say for myself and some of my community, there's a stigma around who has these challenges and who's just supposed to deal with it. And we have to recognize those things as well. But given that language and normalizing that this is something that haunts us all. We're all a step away from, the mind saying, I'm going to have my way for the day. And so normalizing it and being relatable and giving the language and context so people can say, hey, I'm not bipolar if I have not been diagnosed with that.
Excellent. Thanks, Shamir, and thanks, Lucy. We have about 4 minutes left, and hopefully we can address a few more questions. Muriel, you have a unique lens as someone who's serving. My Zoom's frozen. Are we good? Okay, good. You have a unique lens in terms of serving underserved community. Your bio used the phrase "those least served." Tell us a little bit about how you have seen COVID and the pandemic impact access and equity to services.
Thank you for that question. That's great. I feel like COVID is a situation where we shared the trauma, right, as a world globally, right? And so we can say that it was something that we all experienced, but it really highlighted, while we all experienced it, there's some real disparity in how individuals experienced it because of resources, right? So I think it shined that in regards to disparity in healthcare for physical well-being and disparities in regards to mental health care and a lot of other things. But it also kind of, and I can speak for Health Brigade in particular, but I think for a lot of other organizations, but it also forced us to be really, really, to recognize and be aware about those disparities and recognize that we had to do something and we had to create a shift. And so access changed, just like we're doing today, right? From one day to the next, I can speak for my agency, from one day to the next, we had talked about telemental health in the past. It was kind of something that someone had mentioned, and it was somewhat at the bottom of the priority list. It sounded like a good idea, but it was daunting to have the technology, and will the clients respond, and how will we make it work, and do the policies change? And so all of a sudden, there was no option, there was no choice. We needed to do this, and interestingly enough, it wasn't as hard as everybody thought it was going to be, and people were very responsive. And Shamir mentioned this too. We all of a sudden recognized that, wow, we are available, and we're making our services available to people that would not have had access to coming to our physical building, right? Because of transportation challenges, because of schedules. I can't tell you how many of the clients I saw all of a sudden could be seen at 2 o'clock on a Monday while their child napped, right? But couldn't have gotten on a bus to come see me with their child for a therapy session, or the client that still today sits in their car in the parking lot of their job at noon, right? And would not have had the time to come see me. So the nice thing is, I think telemental health really broadened access to a lot of people for care. Now, unfortunately, there are still limitations to that. Not everybody has internet. Not everybody has a private place to speak to a professional, and not everybody has a safe place via telemental health. So, it's not perfect, but it has created an opportunity for folks to be seen and to receive services that maybe would not have had would not be available to them in the past. So that's a good thing. So I think it did two things. It made mental health it brought mental health to the forefront, right? So we heard famous people talking about it, and it was on the news, and people were posting about it on their Instagram. And so I think the stigma was kind of lessened a little bit because everybody was struggling due to COVID. So that's kind of, it's good that the stigma was somewhat lessened. We opened up access with telemental health services, but I also think, and I know the good thing, unfortunately, but it also really highlighted the disparity in resources, the disparity in who could afford it, the disparity in who could even find the type of care that they needed. So there's some good things and some bad things. The good news, I think, right now is that I don't think telemental health is going anywhere. I think this hybrid model is here to stay. And hopefully that means that more people are getting served than maybe a couple of years ago. John, I think you're on mute.
Apologies. Thanks for catching me. I think that's great. That's not just focusing on a silver lining. That's really focusing on the what's strong that came out of what otherwise could easily be perceived as a crisis and a tragedy. That a lot of good things did come out of it. Amy, can you tell us a little bit about what the health department that you serve, Richmond and Henrico County, support community members in managing their mental health in the good times as well as the crisis times?
Sure. Yeah. And I saw actually a question about this in the chat, which I'll address a little bit as well.
Please.
So a main thing we do is a couple of kind of programs, connect folks to medical homes and other social resources. So we have a team of social workers and community health workers. So we have 18 of them across Richmond and Henrico who often are from or connected to priority communities that we focus on to provide those medical and social connections, follow up with them, but also often identify with that community, culture, and language to be able to meet folks where they are. They've all received the mental health first aid training, and really, not only the practical of like, here's where you can go to get food, but also the, hey, I've been there too. This was my experience. Tell me about yours. How can I support you through that? So both of those aspects have been really helpful. Another thing just wanted to make sure folks were aware of is through American Recovery Program Act dollars through the city of Richmond, we've actually been gifted a health equity fund. And there's 7 priority health equity fund components, and one of them is mental health. So we've actually been able to invest in some of the community-based mental health organizations, services, and providers. For example, one of them is a full-time mental health clinician in several of our public housing communities.
Excellent. Excellent. One more question to Shamir, and then we're going to go to some audience questions. And Amy just mentioned it, mental health first aid. Shamir, can you give us the super quick version explanation of what mental health first aid is, which I know you're an instructor in, and how people can access a mental health first aid class if they want?
Okay, mental health first aid is I'm going to say in the field of like CPR, it's for lay people, because you know doctors have their tools, but for lay people, how do you educate yourself, because sometimes what you think you're seeing is not really what you're seeing, but how to recognize, stabilize, and get someone to the appropriate care, because again, as a lay person, you may not be the appropriate care. So with the education part, you get educated on what are some of the common mental diseases and disorders, and how to recognize one for the other one, and how to walk someone through from being in a heightened sense to where they're kind of self-managing, and then saying, hey, this is something a little bit more out of my hands as a neighbor, coach, friend, and you should reach out to someone much bigger than me who can help you address these, and that would be probably someone like a medical provider. I would say if anyone's looking for mental health first aid, since it's become one of the new popular hot things, I'm sure if you just even Google mental health first aid, it's going to probably be a lot of community locations that are offering these trainings. Again, they are very useful. What I love about it is it helps you look personally first. Before you go out and want to save the world, it makes you self-reflect on what kind of trauma and baggage do I bring to the table, or before I come out of the door. And it kind of gets you thinking about, how am I perpetuating? How am I helping? How am I not helping? Do I have some stuff that I need to address? It helps you look at yourself first. And then how do I apply this to others? It's a very great tool to just have on a tool belt, just in case, you're needed.
Because when you need it, that's not when you want to start hunting for it. You want to have it in your back pocket.
It's better to know about resources before the crisis happens, because to do it in a crisis, it could just, cause a lot of other crises to happen.
Amen. I think Amy sort of answered one of the questions that came in the Q&A, which is about having access to services in the community. And also that's been answered a lot in the chat with a lot of community resources. Hopefully that's been adequate for people who asked that question. And then there's an interesting question, which I'll invite anybody who wants to try to answer. I think it's a university dissertation to answer. But the interconnectedness of social determinants of health, lack of economic stability, safe and affordable housing, and how it impacts mental health, and what evidence-based practices could be addressing those. Again, that's a college dissertation right now, to be able to answer that. All those are very much connected. Anybody want to maybe chime in on evidence-based practices that can address the root causes of mental illness rather than just the Band-Aid approach?
I want to give just to the example of mental health first aid. You have immediately after trauma or crisis happen, you're most likely to go to someone who you know and you have access to, like a neighbor, a football coach if you're an athletic person. So I would say that's an evidence-based of when you give people who are doing the work the tools, whether they are a provider or not, but if they're doing the work and you just allow them to have access to the tools, that they're better to be able to make better decisions, better care for someone. So as a provider, I just want to give the tools that I have to people who need them in the community, because we close at 5. We're going during the holidays, and trauma and crisis still happen. There's no time around that. So giving the tools to people who need them, so when things happen, they have them right there with them.
Thanks so much, Shamir. Anybody else want to chime in on that?
Well, I'll just add that I think it's well researched on how the hierarchy of needs occur, right? So the intersectionality shouldn't be surprising, that if I don't have safe housing and sufficient nutrition and food and feel safe, some of the other work that I may need to do in order to be my best self, it's harder to do. right? We see that in children all the time. We expect children to learn and to sit quietly in school and, take in this information. That's why they're there for. But if they don't have those basic needs met, that's an unrealistic expectation. And I think adults are in the same boat. So yes, I think that intersectionality should not come as a surprise. And we can't be blind to those basic needs that they need to be met initially before we can really expect people to kind of, do the hard work that they might need to do.
Great. So we have our last question for our panelists, and then we're going to conclude with our last activity with a wonderful additional guest that we're going to bring in. So in a concise way, I invite you to be concise so Ashley can have her time. Ask the panelists, what are your action items for our audience? All those who are here participating and viewing both in real time and asynchronously watching the recording. What would your action items be for the people who are watching this in order to support maybe those in the community, those that they love and care about, or serve? What action items would you give to people in order to promote mental wellness and mental health? And Muriel, we'll start with you.
That's a great question. I'm going to not talk a long time, but for me, it's don't be scared. Get comfortable with the discomfort. We don't talk about it. So I'm all about talk about it. Talk about your own self, your own mental wellness. Allow your friends and family and your coworkers and your neighbors to talk about it. Don't think you have to fix it. Don't think you have to have all the answers. We frequently avoid the conversation because we don't know what to say. We're scared we're going to say this wrong thing. We think it's too big of a problem to address. How about just, be okay being a little bit uncomfortable and be okay saying what I can offer right now is just listening. I can offer a non-judgmental ear. I can sit with you and hear you out. And that's therapeutic. Coming from a therapist, trust me, that in and of itself is very therapeutic. So don't be scared and don't expect that you have to have all the answers and avoid the conversation because it seems too big to have. So just be open and welcoming.
Awesome. We are developing an immense list of pages and pages of wonderful bullet points as take homes for people. Lucy, invite you in next.
Yeah, I would just piggyback on what was just said in that it is a small step that can make a huge impact. So you don't have to eat the whole elephant at one time. You can take it a bite at a time, to be cheesy there. But I think the best way to sum it up, there's a Tanzanian proverb that says, little by little, a little becomes a lot. And I think that is absolutely true when it comes to advocating for mental health, whether in the workplace or outside of it.
Great. Eric, I'll invite you in next, and then Shamir and Amy will bring us home.
Sure, I have three. One, just get involved. I mean, we have a volunteer wing hands-on at the foundation because one significant issue, as we know, is workforce. So capacity is a concern. So please get involved. There should be a link to hands-on. Also, be interested in establishing a donor advised fund at the foundation. Sarah Levy, a philanthropic advisor, will be happy to speak with you. She should be in a link as well also. And this is my senseless plug. I'm on a board of Voices for Virginia Children. They do great work. And I would say that please reach out to them from an advocacy standpoint, because that's real, transformative work and can have significant impact.
Excellent. Shamir,
And here at the East End at Peter Paul, we just relaunched our Lunch and Learn series. I encourage anyone who's looking for a way into the East End or just want to come by, whether that's the work, play, just a way to get acclimated to the East End. Our Lunch and Learn series, our executive director, a couple of staff members, we take a tour around the building. We have some great new additions to the building. We take a tour around, we learn a little bit about the history. We have a catered lunch together. Just the opportunity to really get the child's experience up here at Peter Paul. It's really cool, cute. I'm biased about it. But we also have on our website like a la carte of volunteer options. I think Eric mentioned get involved, where you can be a a reading buddy, a math buddy, just spending time with the kids. If you want to, I do community walks around the neighborhood where I'm like passing out supplies, not to sell our program, but just to say, hey, neighbor, we're your neighbors at Peter Paul. We're here. And then when we do have programs, we never have to worry about an audience because people remember us being those people who were walking around outside bugging them at some point. So if you're looking for a way in the East End, come on over at Peter Paul and hang out with me.
Sweet. And you won't be disappointed. Amy, last words.
Two things. One, I mentioned our Health Equity Fund. We will put out again a call for nominations. So organizations that initially don't have to apply. You can actually nominate anyone you know who's doing good work, even if they're not a part of a broader organization. So stay tuned for that. And the second thing is invest in our youth. We've kind of picked up threads of that, but our youth right now is, as we've talked about, like really bearing a lot of the effects of the pandemic. So if you are someone who wants to be with kids, volunteer. If you're someone who has money, give to youth-based organizations. If you're someone who has space, a church building or a rec building that wants to open it up for a Saturday night basketball session, whatever it is that your gifts that you have, really investing in our youth.
Well, super big thanks to all of our panelists, as well as Mary Beth, for sharing their time with us, as well as their talents and skills, definitely experts in their fields, and a wonderful blessing and benefit for all of us to be able to share in their expertise. Thank you so much. I will acknowledge we're probably going to run a few minutes over tonight, and that's my responsibility of time management, so I apologize. But our next presenter that we want to bring to the stage for our last time to close us out is Ashley Williams. I'm very privileged to be good friends with many of our panelists, as well as Ashley, and to have seen their amazing work in the community as well as in their lives. Ashley is a mind-body therapist and wellness educator with 12 years of experience in the fields of education, behavioral and mental health, and community programming in Richmond. She's the founder of an organization and a service provider called Bare Soul Yoga and Wellness and Mindfulness on Life and the Wellness and the Well Collective. She's amazing, and we wanted to invite her in to conclude us tonight, to bring us a moment to promote our own mental wellness tonight. So, Ashley, I invite you in, and thank you for being here.
Thanks, John. It has been a pleasure to witness and to experience all of the knowledge and the information that each of the panelists shared on mental health. And so we will just take a moment to reflect. And so as we move from this conversation, I always have a phrase that stays near and dear to me, which is, I am well, we are well. And so as we move from this conversation, we must continue to acknowledge that each of us experiences mental health in some capacity, regardless of our individual identities, our roles, our responsibilities, and our resources. It's critical that we combat the personal and social stigma seeking mental health care, specifically for our individual and collective well-being. So the one thing that we know to be true, which many of the panelists mentioned, is that social connection is one of our basic human needs, and that each of us deserves and desires to be seen, to be felt, and to be heard. So I think I invite you to heighten your self-awareness and social understanding so that we may innovate and change our response, our action, and policies to really highlight the importance of mental health care. I invite each of us to acknowledge and to identify how we play a role in our collective well-being and experience. So as you think about your workplaces, your communities, your neighborhoods, your friends and family groups, I invite you to sit with these questions before we move into a practice. How can you encourage diversity of thought around this topic? How may I create a culture of trust? How may I foster leadership and support my environment to be welcoming, non-judgmental, compassionate, and restorative? So as we conclude our time this evening, I invite us into a closing practice, one that takes in stillness and reflection, acknowledgement, and hopeful action. So wherever you're landing, whether in your house, whether in your workplace, you might even be taking this in driving. Just take a moment to find some stillness if that feels okay for you. If it feels good, you might close your eyes or find a grounding gaze. And this practice is one called loving kindness and compassion. Just taking a moment to settle in and invite yourself just to think about you in this very moment, and saying this silently to yourself, or maybe even repeating it gently aloud. May I be safe and protected. May I be healthy and well. And may I experience peace and live with joy and ease. And allowing yourself to then think about someone that you might have come into this conversation at the top of your mind. So that could be the organizations in which you work within, it could be a loved one, but just bringing either those people or that one person to the top of your mind, thinking about them and reciting this and sending this wish to them. May you be safe and protected. May you be healthy and well. May you live in peace and experience joy and ease. And then thinking about our community as a whole, our world, maybe thinking about the youth that we talked about this evening. And including ourselves in this wish, may we be safe and protected. May we be healthy and well. And may we live in peace and experience joy and ease. If it's helpful, just take a supportive breath and then invite your awareness back into our collective space. And sending these wishes to each of you as we leave this fruitful and critical conversation tonight. Remembering that wellness is the act of practicing daily healthy habits to attain better physical, mental, social health outcomes, so that instead of just surviving, we're thriving. So on behalf of RVA Engage, affiliated community partners, our panelists, we deeply appreciate your time and your presence during this session of Civic Action Conversations. So please take a moment to complete the survey. You'll find that in the chat. It'll also be sent to you via the follow-up email. We greatly appreciate your feedback as it helps us plan for future conversations. So with that, thank you for joining and have a restful evening. Take good care.